Well, good afternoon, folks. How are we doing?
Good, thank you. How are you?
Doing well, thank you. And welcome back. It's so exciting to have both of you back. And just for folks who might not have been part of our first conversation, we are rejoined and re-welcoming Nicole Pallone and Tanya Chute Nagy from CanPKU Plus, executive team right here, front and center on our podcast today. And again, welcome back to both of you. Thanks for being here.
Thanks so
Thanks
much.
for having us.
Yeah, thanks for having the time to be with us or spending the time with us today. Um, I think this series has just been so um, eye-opening for me, as well as emotional. I'll be honest with you, like kind of listening back to some of the conversations that we had, and I have my own sort of highlights and points that kind of really stuck out to me through this wonderful series that you helped us to curate. So first of all, thank you for that. Thank you for helping us to curate this series. But I look back on the conversations we had with John Adams and Melanie Coulter, Maureen Smith, she was so great, Beth Potter, and of course, you folks were part of that series as well. And as we kind of frame this and get to the second half and kind of close the chapter on our series, I really would love to know, Nicole, I think I'll start with you, really, where you think some of the opportunities still exist, I guess, for people to better understand the PKU community and what you're trying to accomplish.
Oh, well, that's a big question
So
to
much,
start
I
with.
know. Big question to begin with. Yes.
Thank you for that, and thank
Yeah.
you first and foremost for this series. It's just, I think, done a lot to highlight a lot of the different challenges that we
Mhm,
face
mhm.
as a community. Um, I think. Oh, sorry. See, we might have to edit. What was your
Yeah.
question again?
So more like from the community standpoint, there are things we know that people still don't fully understand. Maybe it's
Right.
like
Yeah.
you talk about the realities of the community or misdiagnoses or not enough testing. I'd love to
Yeah.
kind of hear your perspective on those things as we think back through the series.
Yeah, there's always just so much to learn and so much to
Yeah.
do. Education is our tagline is education leads to better health, and
Mm,
we believe that fully. So whether that's educating patients and caregivers or educating, our communities around us, researchers, government officials, um, all of all of them need a little bit more education,
yeah.
in terms of the best way to manage the condition, the new treatments that are coming, how
Mhm.
we can make sure patients have access to those treatments. The episode with John Adams speaking about advocacy, such a huge topic. You guys really barely scratched the
Yeah.
surface
How
because
could
there's
we? Yeah.
so
Yeah.
much to do, right?
Yeah.
And the reality is we have a lot of new and frankly not so new treatments for PKU and some of these other rare disorders that we represent
Mm,
that they're approved by Health Canada, but they're not funded. So they're not actually accessible because rare disease research costs a lot more than, common disorder research,
right.
and therefore the cost of the treatment is more, and it's just unattainable to a lot of families. So
Mm.
we have a lot of work to do there for sure.
You just kind of touched on something again that I feel like is such an important aspect of this, Nicole, and that is sort of the equity, right? And when I think about what are still some gaps that may be less visible than others, I feel like equity is one of those things that is kind of like an invisible gap that people don't always see. You also mentioned there's older treatment, there's new treatment. So daily life, I guess, managing PKU, I think there's so much more to it than just managing, like, the nutritional aspects of it, right? And do people kind of oversimplify that, or is there an opportunity for us to kinda help people understand there's so much more to it than just that?
Yeah, I think so. I mean, it is a very complicated diet compared to a lot of diets out there in the world.
Right.
So there's that in itself, but beyond that, there's so much more than just the dietary management. There are medications now. I do strongly believe we'll see a cure for PKU in my daughter's lifetime, which
Mhm.
is a huge goal and one of the reasons the organization supports research as much as
Right.
we can. But we do Canada's healthcare is one of these glorious things that we're all very grateful for and proud of, but it does need work, and we refer to it often as the postal code lottery. So,
Sure, where you
what
live. Yeah, yeah.
yeah, absolutely, like, you can be literally half an hour apart, and it can be that's 2 different newborn screening programs, so maybe a rare disorder is getting screened, like HCU is in one area, but not getting screened half an hour down the road. It's
Wow.
really that crazy, and same thing with funding of medications and treatments.
Mm.
So, yeah, it's our postal code lottery.
Yep.
Go ahead,
Yeah.
Tanya. What else?
Tanya, please. Yeah.
I also you touched on it with Beth at one point in your conversation with Dr. Potter when you said, like, didn't we already take care of this in the 60s when this came out as a
Yeah.
newborn screen test, right?
Yeah.
So it's not just like because of the evolution of everything going on, we are still looking for better than just
Mm.
okay and no longer fully challenged. So that research is still there, that those pieces of the puzzle are still there. Is there different health impacts with
Yeah.
eating better foods and more wholesome foods
Mhm.
as you're taking
Mhm.
a medication that's been
Yeah.
paid for?
Mhm.
And to what Nicole was saying with rare disease, it's less opportunity in rare space, so those drug manufacturing research costs more, but also
Mm.
the people buying it are spread out so far. There's, like, so
Right.
few of them that that can be looked at twofold. One in which there's less people to cover the cost, but
Mhm.
also there's less money needing to be spent. We're not spending
Sure.
this rare disease dollar on
Mm.
everybody,
Mm.
right? So it's I mean, I'm asking, obviously, Canadian
Mm.
taxpayers to help my child with this basically,
Sure.
but the cost is not it's not giant for all of our population.
Right, it's not as astronomical. Yeah, sure, I understand that. And this postal code lottery thing, it's such an interesting
Mhm.
concept to me that you just mentioned, as a public health person myself, obviously, I'm in the States, it's different than where you folks are.
Zip
Um,
code
and
lottery.
zip code lottery, postal code, zip code, yeah, sorry, yeah. But is there more, I guess, from a falling through the cracks perspective, right? Is there more that can be done in your minds? Is
Oh,
it Yeah, I'm sure there's a lot more, but is it rooted in the geography, or is there another systemic aspect to that too? It sounds like geography is one aspect. Are there other systemic aspects as well?
yeah, so, I mean, there's boy, we could just talk for hours.
Yeah.
In Canada, our social programs are all of our programs are either federal or they're provincial.
Mhm.
Healthcare is a provincial responsibility.
Sure.
So there's like that is in our constitution. That is not going to change.
Right.
And what that means is it's almost impossible to even think about all of those provinces doing things all the same way.
Right.
That's not very realistic. What is a lot more attainable and realistic is expanding our newborn screening programs so that they are
Yeah.
equitable throughout all of the different provinces and campaigning for funding of treatments for
Mm.
what each province pays for, right? Is those are campaigns we can undertake, but Matt, we have learned in the past from the successes we've had in some of our advocacy campaigns, they require a substantial amount of time and effort,
Mhm.
and
Mhm.
our capacity constraints really inhibit our ability to make positive change
Yeah, that
to help
makes
patients.
yeah.
There's just so much to do.
Sure. And is that where the community kind of aspect comes in? Because I think of this as you were talking, I think about what you have done with Can PKO Plus as an organization, right? As a nonprofit, as a foundation. You talk about the provinces and the work that they have to do with the federal government, national health level. But to me, there's this community that you folks are building that is a hybrid of all of that or a combination of all of that. And talk to me a little bit more about the community that you've built. within CanPKU Plus and the role that you've played there.
Yeah, I'm like so honored to just be a part of the organization and be a part of that growth and
Yeah,
community outreach that happens. And I really firmly believe, and I think Tanya does too, that those connections also
yeah,
lead to better health outcomes.
hmm
I think patients that find that community do better. And we did touch on it, in our first episode that
conversation.
Tanya and I
Yeah,
did. And like our in-person events, I think, are by far the most successful way. We have rave reviews from everyone who attends
I
every
bet they're
time.
great. Yeah, I bet they're
They
great.
really are fantastic, and you can't no amount of Zoom or,
Yeah, makes
video
up for it.
meeting can
Yeah.
replace that, but they're a huge drain on our resources. The staff
Mm,
time to plan them, the
hmm
actual cost of putting them on.
hmm
So, I mean, we'd really love to be able to expand our outreach there too.
Yeah, that's amazing.
Yeah,
You
it's
had
not the
mentioned,
it's not the conversation that happens in the Zoom. It's the one that happens in the lineup getting lunch. It's the one
sure,
that happens in the
in the
bathroom.
bathroom. Yep.
Those are the ones that mean the most.
Yeah. Yeah, I had a guest
Mhm.
on last week who said the most meaningful conversation she had was in the ladies' room, right? Like,
Yeah,
it's
Yeah,
just like those kinds of you turn
absolutely.
to the person next to you and it's just you have this amazing connection in that moment, right? That is not the most unexpected connection becomes the most powerful one, right? Um,
Often. Yeah.
oftentimes, yeah. We had talked a little bit about this in our first conversation, and anybody who kind of goes to your website sees that. But we mentioned community, of course, but your pillars, your
Yeah.
CARES, your cares pillars. I think these to me are so integral to what you are doing. Like, yes, we need data, we need registries, we need community, we need screening, we need all these things, resources. And you're trying to kind of encapsulate all of that in your cares pillars and build a program that stands the test of time. So can you just recenter us again in your pillars?
Sure, yeah. So
Yeah.
CAMPKU plus cares. Community, we already spoke about a little bit and how
Yeah.
important that is, as we did with advocacy.
Mhm.
Unfortunately, there's still a lot of advocacy
But
work to do.
yeah.
Research is another big piece that we support as an organization. And you spoke with Dr. Potter and Maureen Smith
Yeah.
about the importance of patient voices being involved in
Yeah.
study development and CAN-PKU Plus partnering with Inform Rare to develop that Canadian PKU patient registry,
Mm,
which ultimately is about building evidence and helping policymakers have what they need to make decisions that get treatments into our hands.
mm.
Um, the E is for education. So, I mean, this series is a great example of a way to help kind of educate the general public about all the challenges we face, and again that the education is just such a key to making anything better,
Yeah.
in my
Yeah.
opinion. But the S at the end is really for support and sustainability. And I think, we've got some pretty good community support programs in place that we've established over the years. We have a, a starter kit program. We provide
Oh.
kits to clinics across the country,
Mhm.
and they will just say, like, oh, you're newly diagnosed. Here is a box of what you need to help get
Mhm.
you started. So you're not scrambling with a newborn trying to figure out where to buy all these things. So
Right.
that's something we just give to clinics and they give out. We have a travel scholarship program where
Mm,
people can apply for a scholarship so that they can, offset some of the costs to come to our events.
sure.
And our disability tax credit program is a huge support for Canadians
Mm.
in getting access to that tax credit. Sustainability is an ongoing challenge, and as chair, I do feel like that's really my key responsibility
Mm.
is finding a way to make sure this organization can continue,
Right.
and continue to grow. Um, so we have done a good job over the years in diversifying our income a little bit. so that we have multiple sponsors, largely due to the work Tanya's done in outreach to all those different companies that have, an interest in this rare disease community. But our main, like the majority of our budget does still come from industry sponsorship, and it's kind of a conundrum because on the one hand, by far industry is the place that has some money to give for
Mhm.
organizations like ours. On the other hand, we've been criticized over the years for
Really?
accepting money from industry. Yeah,
I see.
I don't know if that happens as much in the US,
Mhm.
but really, there's sometimes perceptions that we're, yeah, too close with industry or
Yeah.
somehow, like they're pulling the strings, and I can assure you they're not.
Sure.
It's really just they're giving us the money and they're trusting that we know how to use it best. And
Mhm.
but yeah, it'd be nice to not have to rely on
Yeah, as
industry
much.
so much and
Yeah.
have some other income
Yeah.
and whatever that may be, grants, donations, etcetera, that help with the budget.
I'm sure part of that too is you've done so much work to prove yourself, right? And to show that you've earned that trust from those industry partners wasn't just given to you, that was earned, right? And I was in a
I hope so.
similar yes, I'm sure it was. I was in a similar situation early in my public health career where I took industry funding in an effort to create a public health campaign, a public awareness campaign around sudden cardiac death, but
Mm,
it was funded by industry. And again, same thing. Industry had trusted us that we were going to do the right thing with the money to launch this public awareness campaign around sudden cardiac death. And of course, yes, a big way to prevent sudden cardiac death is implantable devices, right? That shock you if your heart does stop. But that wasn't the goal, right? The goal wasn't to get everybody to get an implantable device as a safety measure. The goal was that it's a very misunderstood disease, and we wanted to get people to understand it, right?
yeah.
But we didn't. That trust wasn't given to us either. Like that trust was earned as 20 years of patient advocacy work and patient education work in cardiology. I know it's the same with can PKU plus where, the families you've worked with, the advocates, the researchers, the allies you've built, you didn't that wasn't given to you. I'm sure it was earned, right? So,
Yeah,
And
it
we're
takes
we're still
time.
trying to
you're still
maintain
trying to earn it.
earning that, right?
Right.
Like,
Yeah, absolutely.
it's not just the industry that had to trust us to hand that
Mhm.
money over, but
Right.
it's the community, it's the clinicians, it's the people that need to trust that our decisions are based on what's best for the organization and our community,
Mhm.
not the people who are
Yeah.
helping fund it.
Yeah, totally. So I understand the sustainability challenge and I know you're working hard to overcome that. Is that Nicole, Tanya, is that the most pressing challenge you feel today? Is that this organization lives beyond, or is there still more things that kind of frustrate you and challenge you as it pertains to barriers? I'm sure there's many. So maybe pick your favorite. But it's beyond sustainability, I guess.
Well, I do think I see right now sustainability as that key to getting us to all those other things.
Sure.
So there's ways to grow and improve and do more in all of these different areas, but we can't do that unless we're sustainable.
Right.
So,
Makes
and
perfect sense.
right, the easiest, unfortunately, we don't have any like millionaire families in our rare disease community that are
Sure.
regularly donating. So, at least not yet. Maybe they'll
Right.
come. But that being said, there are really easy ways for everyone.
Mhm.
Every one of your listeners can support by becoming a member. Super easy. You can go to our
Mhm.
website. There's a little join button on the top right, and it's 25 $30 a year if you're not
Well,
directly related to one of the rare disorders, right? Like, it's
sure.
not super expensive.
Right.
That actually does 2 things for us, though, because the little bit of money does help, of course, if our membership is up, that contributes to our budget. It also makes a difference when we are talking to policy decision makers because, they sometimes say, "Well, how many people are we talking about? How many people do you represent?" And
Mhm.
when that number is really small, it's well, let's flip that. If that number is large, it holds more weight.
Right, that makes
Um,
sense.
right? So that's super helpful.
Mm.
And of course, donations are always welcome for sure. Honestly,
Like
donations are a very small part of our budget,
yeah,
and I'd really like to see that grow.
$30 a year. I mean, it's kind of a no-brainer, right?
$30 Canadian a year. So let's face it, this is
That's true.
even more affordable for your listeners.
That's very true. There is some momentum though, right, Tanya? I mean, there's some real progress that's happening, Nicole. There's some real progress that's being done out there. Breakthroughs, if you will. You talked about the innovations. Um, is there something that you're particularly excited about now or proud of right now as it kind of pertains to and maybe it is the fact that you're building this sustainable organization. I'm curious, maybe look at it from two sides of the ones that are more of the clinical breakthroughs or the clinical innovations, and then maybe some more of those community innovations that you're really excited about, giving you hope, I guess, where the real work is getting done, the big work.
And
I'm definitely less political than some of the organizational needs that are out there. I'm
Yeah,
people, so I'm
yeah,
still very excited about relationships that we're making on a regular basis, be that
yeah.
with clinicians, families, partners, whomever. Like, I
Whomever,
think
yeah.
we do that well, and
Mhm.
I think that
Sure.
that's really important for our
Yeah,
community's growth.
yeah,
And there's sustainability as well,
yeah.
and also the growth of, our umbrella has been opened, and we have more disorders that we're covering,
Like
and
HCU,
that.
for example, and
Yeah,
yeah,
super
yeah,
exciting
yeah,
with
yeah,
that growth.
yeah.
I play in the pillars every single day. I kind of feel like Nicole put the pillars in place, in a little bit of in a framework. I'm a squirrel, so I have to be able to be like, doesn't hit one of the five. I need to carry on, or,
Right.
but all jokes aside, there's growth everywhere,
Yeah,
and it's exciting to see. But the sustainability, the funding, the people that are actively engaged in making those changes
mm,
in the CARES steps, right? The
yeah,
ones
yeah,
who do have political in their heart and give that time.
and to be fair, donations are great, memberships are great, but volunteer hours are also
yeah.
like
Big,
Mm,
yeah,
the community that benefits from what our organization does is the very community that has that extraordinary burden of care because of what they're living with. So
mm,
their capacity to volunteer, everybody is stretched thin. Everybody
yeah.
has stuff going on in their lives, but then you add these complex medical conditions on top and we unfortunately, yeah, those volunteer hours are few and far between. So,
Yeah.
um, that's a challenge too.
Yeah. I have so many organizations approaching me looking for our help in acquiring volunteers for them. So I truly
Mhm.
understand the challenge that's associated with that. They reach out to us as a university and want us to present them to look for student volunteers or staff volunteers. It's ongoing for sure. Yeah. We we started our conversation before we went on air. We were talking a little bit about what yesterday was, and yesterday was Mother's Day, right? And, I'm still sort of stand in awe of folks like you who, you have made this transition from parent to advocate and you've shifted that role. But that doesn't mean that you can stop being a parent, right? Like you're still a parent, even with this transition and how that transformation has impacted and informed your perspective of this rare disease. How are we balancing or blending that still to this day? Maybe I'll start with you, Nicole, and then Tanya, you can give us your thoughts too.
Yeah, I don't think you can separate the 2
Mm,
really. I am an advocate because I'm a parent, and
yeah.
I don't think there's any force more powerful um, than a mama bear, right?
Yeah. Yeah.
So I think, that's what led us to, um, advocating for the change that needs to happen is all about trying to make lives better for our kids and being there for each other and
Yeah.
teaching each other how to navigate this rare world as best we can.
Mhm. Mhm.
Tanya, do you want to add?
Yeah.
Yeah, I mean, echoing the same, and it's tricky in some regards because not all of our children have rare. In both Nicole and I's stance,
Sure,
we have
sure.
we have
Yeah.
non-rare kids that live in the same house
Right.
as the
So
rare
there's a
ones.
balance there too. Yeah. Yeah.
Yeah, for sure,
Yeah.
right? But, it's just what you have to do, it's just what you do. If it's raining outside, to grab your umbrella, it's just what you do. Um, and, I mean, being Mother's Day, yeah, we recognize all the moms in our world that are
Yeah.
wonderful. And so at the start of the call before we came on, Nicole mentioned, I almost made her cry yesterday, which is really exciting for me.
Is that
Um
something you strive to do?
It doesn't happen easily.
It doesn't, but it was just a simple text to be like I don't even remember exactly what I said. I mean, I know the sentiment and the heart behind it,
Yeah.
but basically, thanks for showing me that I could be the mom of someone that
Yeah.
was rare. Thanks for
Yeah.
being that person
Sure.
that got me through and gave me
Mm,
the courage to be this
mm,
mom, right?
mm. Yeah.
So, yeah, I don't
And I just again, the responsibility that you take on and you must feel in your roles to me is just so impressive. And I know the both of you have this like remarkable way of like just saying like, yeah, it's what I do. Like you said, it's raining, I grab an umbrella. It's like what I do. But I want to acknowledge that it is more than just like this thing, right? I think you both realize that, but I don't know. I'm just so impressed that you just have this ability to like be like, this is just what we do, and it's pretty amazing. Yeah.
Yeah, there's good and bad to that. I think,
Sure.
over the years, I have stepped away at times to take a bit of time and it's something I think moms in general don't do very well at
Mm,
is actually taking care of ourselves. And there's
very
all
good point.
kinds of societal demands and
Mhm.
personal thought. It's a very complex issue, and it is
Sure.
very hard to balance.
Mm,
Um, taking care of the family and having a full time job and
yes.
putting significant time into this not for profit organization and trying to make all these changes and our own health issues that may arise and
Yeah.
it's incredibly challenging but yeah, I'm with Tanya. You just do what you got to do and many hands make for light work. So
Sure. Yeah.
the more volunteers and help and funding we can get, because frankly, if the funding is there, we can pay for the time that we need to get the things done that need to be done, right?
Mhm,
So it doesn't have to necessarily rely on volunteers,
mhm.
um,
You
but
can staff it. Yeah. Absolutely.
yeah,
Yeah. Yeah.
either or.
I so just one last thought on Mother's Day. I was on your socials yesterday and you had lovely, the lovely post talking to thanks moms and all the moms of rare disease families and all the hard work that they do. But one of the other things that stood out to me on your socials is May is PKU Awareness Month, right? And
Mhm.
we are in May. So talk to me a little bit about what we're doing, what's going on there as part of PKU awareness. Mhm.
We have lots of kind of ongoing things.
Mhm.
We here in Sparwood just hosted a Spare for Rare event, so a little fundraiser at our bowling alley to
I love that.
and we welcome people to host these across the country or the US, anywhere you
Mhm.
like. So and you can organize it. They're very easy to organize, and people come and bowl and make a donation, and it goes to the organization, and
That's great. I
it's
love
just
that.
great.
Yeah.
So
Yeah.
that's one of the ways, and a lot of social media, of course, but
Sure.
Tanya's the pro at that stuff, so I can pass that off to her.
Yeah. What kind of engagement are you looking for, Tanya, as it pertains to your sort of awareness month?
I mean, sometimes it's just as easy as a conversation, right? I have a T-shirt that I wear usually only in the month of May because it can get a little much, but on the back it says, "Ask me about PKU because your kid was tested for it." And
Yeah,
that
yeah,
seems to be a really quick way of being at the grocery store. Someone's like, "Hey, I don't think my kid was."
yeah,
How old are they? Where were they born?
yeah.
Yeah, they probably were. Like,
Wow,
so,
yeah.
so that's like an easy conversation starter. It's also starting we can stop wearing a coat so you can see my shirt, which is handy. But so there's those kind of things. There's also just like we're hoping to have a conversation with whomever wants to join from the community to be like, hey, what's up? And there's a campaign going on that's you post a picture a day or about different rare PKU things. I think that's on our socials too. That
Oh, I
says
love that. Yeah.
post, what does your formula look like?
Mhm.
Do you
Yeah.
what does your meal look like? I mean, everyone does that on Insta anyways, right? So,
Right, right. Might as well do
but
it a little bit more. Yeah.
yeah, who's your PKU hero? Who's your and it's just
Right.
posting a picture a day that kinda keeps it in the forefront of everyone's mind of what's going on
I love
every
that. Yeah,
day, right?
the shirts are so creative to me, like, the shirts that the rare just I don't know if it's just this community or what, but, like, the things that I have seen about, asking me about these things and getting people to engage. I really love that one where you say, like, "Ask me about this test that your kid had that you might not even realize that they had," or, like, what a great conversation starter that is. Yeah. Yeah.
And sometimes,
Unbelievable.
honestly, maybe our friends and family are sick of hearing us talk, and we are all about talking. So it's a nice way to find a new set of ears.
I love that. Um What needs to happen, I think you had mentioned, Nicole, the 5 to 10 years, the cure within your daughter's lifetime. Um, I I know it's a lot of the pillars that we've already talked about. It's the collaboration across the ecosystem. It is the registries and the real world data. But really at the end of the day, like what how do we get there? What needs to happen? Is it and I know it's a big question, but I really wanna kinda
Yeah,
unwind that a little bit with you.
sure. Yeah, it's really interesting because I mean, even my thoughts over the last 18 years of my daughter's life have changed quite a bit in terms of what's the goal. So, I mean, when PKU was first kind of discovered and newborn screening was developed, the primary goal was let's prevent brain damage,
Mm,
right? That was the
mhm,
target.
mhm, mhm.
And the diet came along and for the most part, the significant brain damage is avoided most of the time.
Yeah,
But now the goal is that's not enough, right?
right.
Our goal now is and again, this is different even from when my daughter was born, but now I don't want to just prevent the harsh effects of this disorder. I want her to have a like normal life with a
Yeah.
normal dietary intake and normal goals and normal outcomes
Mhm.
and that I think, we also come from a time where a metabolic genetic disorder was considered incurable for
Right.
decades.
Right.
That
And here we are.
the
Yeah.
the
Yeah.
idea of a cure and
Mm,
and the research that's happening and it is a very real possibility
mm.
that we will cure this
Yeah.
rare genetic disorder in the next couple of decades. And that has huge implications across all of our healthcare because if
Mm.
one genetic disorder is curable, then others are too, right? Like
Yeah.
there's just there's a lot to unpack there, but it's yeah, there's a lot to do and a lot of great momentum happening to get there.
And I love that,
Yeah.
and maybe there's a snowball effect here, right? Tanya, go ahead, please. Yeah.
Yeah, I would
Yeah.
also add to that, like, when I remember John Adams telling me when Jacob was born, he's 15, so a little bit behind Nicole's daughter. It was the same he said, "In 10 to 15 years, it'll be cured."
Mm.
And we're not quite there yet,
Sure.
that's okay. Sometimes that little ball that, predicts the future's off by a little bit, but, we've definitely seen a lot of momentum, and I will
Yeah.
say thanks to research and the databases and all of the people who are caring and giving and doing what they have to do,
Mm.
we are that much closer that my son is almost, because he does respond to a medication that's been made available to him through a trial,
Mm,
um, that he's almost at a what you would call a regular intake of food, which means
yeah,
pretty soon he may not need his metabolic formula that's very high in amino acids and all these things. But even though we're here, it doesn't feel like enough because although
right,
I get to say, "Hey, my kid is almost cured," and he gets to live this life, it's not accessible across the country.
right,
It's not accessible in North America to
right.
everybody. So
Sure.
it's also like those short-term goals is just making available close to as my son has and other people who have more than him even, but
Yeah.
it's making that equity across the country available. And
Mm,
so we have that here and then let it ripple out into the other, like we have 4 disorders we're currently overseeing. I'd love to need more because those ones are all taken care of.
yeah, yeah. Wouldn't that be amazing? Yeah.
Uh,
And Nicole.
and in fairness, I don't know if you wanna keep this in or not, but Tanya's son is responding well in this clinical trial to this medication.
Yeah.
This this medication may not be available to Tanya's son after the trial is over. That's the
Right.
reality that we face
Right.
here. So
Right.
yes, it's amazing that this research is happening and these treatments are developing and creating these fantastic opportunities and getting us closer to a cure. But what is the good if the patients can't use them?
Mm. Mhm. Yep. Yep. Absolutely. There is no good if it only lives and exists within the trial, right? So
Exactly.
hard. So hard. Yeah.
Yeah.
Okay. I want to bring it back to we talked a little bit already about the specific actions that people can take, the work that they can do to the work that they can do to start supporting CAN PKU. One more time, what's the most specific action that a listener can take away from this episode with?
The easiest way you can support the work we're doing is to go to our website,
Yep.
canpku.org, and either join, become a member,
Mhm.
um, or make a donation, or both.
Or
Those are
both.
really 2 easy key ways, that you can help us obtain these goals: community, advocacy, research, education, support, sustainability
Sure.
for this organization. Um, and of course, even if nothing else, go to the website, learn something new.
Yeah.
I challenge every listener to go to the website and pick up some new fact about HCU, UCD, MSUD, or PKU, and just share that information. PKU is Awareness Month, so I mean, again, most people have kids that
Yeah.
have gone through newborn screening and do not know what it's for, so
I appreciate that. I appreciate that.
Sign up for the
Tanya.
newsletter so we have ongoing learning. It's gonna be coming out soon, so get on the list before the next issue goes out.
I love that. Plug that newsletter. Perfect. Perfect. Well, again, I wanna thank the both of you for helping us work so hard to curate this series, to get us connected with not only the both of you, but with John, Melanie, Maureen, Beth, all the conversations that you have facilitated, all the families that you're continuing to help, the ones that are just beginning this path, the ones that are mid path, the ones that are far into it, like you folks are. Thank you for giving us your time and your expertise for the work that you're doing around awareness, funding, advocacy, community engagement. Really appreciate it, both of us. And once again, Nicole, Tanya, thanks for being here.
Oh, thank you so much
no.
for having us. Those names that you listed off, I mean, we had no choice but include them because without that, they support the CARES pillars, right? They are the
Yep,
reason that yeah,
absolutely.
so thank you for inviting us and them along.
You're very
And
welcome.
thank you so much for everything you've done to facilitate this and help get some of those challenges out there, and, just one other, we're not all just about asking for help here too,
Sure.
we wanna make sure everybody knows, even if you're not dealing with one of these kinda specific disorders, we're here to help. There's organizations out there to help. Don't feel overwhelmed and like you have to do this alone, because there's lots of people that, even if they're not going through the same thing, they've been through something maybe similar, and we're just, we're always happy to help connect those people.
And again, that's the thing that impresses me the most about folks like yourselves and organizations like you is that you are such great connectors and you're always looking to help people get connected as the best you can. So, once again, Nicole Pallone and Tanya Chute Nagy, thank you both. Folks, once again, head on over to canpku.org and we look forward to speaking with you again soon.
Thank you so
Excellent.
much.
Thanks. Bye.